I'm Autumn Gorovich. I'm a physical therapy assistant here at Hingham Physical Therapy. On a daily basis, I deal with patients through the lifespan, dealing with a multitude of conditions, stemming from post-surgical all the way to balance. I've currently been here for over 1 year. My favorite part here at Hingham Physical Therapy is definitely being able to build a bond with patients and allowing them to instill their trust in the rehabbing process. Kinesiotape was invented in the 70s as a way for the body to promote and facilitate the natural healing response. Ultimately, what we do is we use it in a wide variety of conditions and ailments, anywhere from decreasing inflammation to stability in joints and helping with post-surgical. So the taping I'm going to do is to decrease someone's inflammation that they may have due to an acute ankle sprain, whether it's walking, running, or even an accident. So initially we wipe off the area with alcohol wipes, just that helps the adhesive stick. Depending on how much swelling they have will depend on how many pieces we'll be using. So initially we apply this piece as an anchor. Crosshatch that kind of happens, and this helps decrease the amount of edema that occurs in an area, which improves the lymphatic drainage. So that would be for any edema that kind of occurred due to an acute injury. And it pretty much reduces it. I would think in between visits we see about 20% decrease in the amount of inflammation that kind of occurs in an area. We'll usually measure in between to kind of see the effectiveness and if we have to kind of alter how we're doing things. It just increases the space between the muscle and the dermis to allow the lymphatic glands to kind of work in overdrive. So it basically facilitates a body's natural healing response, which gives them prolonged relief between rehab treatments, which ultimately helps increase range of motion passively and actively. So the next common condition we kind of see is knee pain, and that can be from anything from arthritis to just joint pain due to running, and there's a couple conditions that come along with that. People even going up and down stairs can say they elicit pain, and there's not always an exact reason, but some of the things we do with the KT tape helps give the knee stability. And I can kind of show you a technique that really helps with that. So again, we use the alcohol to help the adhesive stay on better. A big thing is they can wear it, this specific type they can wear it in the shower and they can play sports. So it'll last up to 5 days. So this helps. So some people say they have elicit some pain down here. So this gives the area some stability, decreases discomfort, right around the kneecap, with allowing the kneecap to still have the right mobility. The pull is different, so this is about an 80% pull. You really want to give the knee, it's kind of, my patients kind of will describe it as like a nice hug for the knee, and then they sometimes don't feel like they have to use a soft brace, that this kind of acts in its place. So this is really good. This helps a lot of young athletes a lot that tend to have some pain through the kneecap area. Gives them some support and stability, especially with some of their sports that they play in between coming to see us. And it definitely has helped with some of our arthritis patients as well. So ultimately, some of the questions we typically ask to make sure that they're a right candidate for kinesiotaping is that there cannot be an active cancer, at risk for an active blood clot, and also if they have any issues with adhesives on the skin. So those would be reasons we could not use it. So another common condition we see is plantar fasciitis. And with that condition, having pain through here, people tend to compensate by going in and out with their foot. So we can inhibit the plantar fascia with the taping while adding some ankle stability. So the biggest disclaimer we give people is to not use a blow dryer to dry it off because it adheres to the skin. And then when you do take it off, to try to have it submerged in water. It's meant for athletes, it's meant to be submerged in water. You can sweat with it, you can bathe with it. So the shortest amount of time I've seen someone have it on is probably 3 days, the longest is 7. So the adhesive is pretty strong. So I use it more than half on my daily use, and I've educated and taught the fellow therapists here how to use it pretty extensively. We find that it just aids in rehabbing them, and they're really getting better results a little bit quicker. We also educate them on how to be able to use it themselves if they feel that they need to down the road. So another common reason we use KT tape is for shoulder stability, and it's for a wide variety of acute injuries, sometimes even post-surgical. And even if the shoulder just feels like it needs increased stability or decreasing some pain. With this, we use a pillow. We let them rest their arms down. She'll sit up nice and straight. Good posture. And again, this is kind of like a hug for the shoulder. So it comes to the front of the shoulder, and then the back of the shoulder. It was actually Dr. Kenzo that came up with it and developed it during his chiropractic practice. So this typically will allow patients to go through range of motions that otherwise would be pretty difficult for them to go through, really decreasing the pain symptomatically that they have. Sometimes, especially with shoulder patients, they'll say they have issues sleeping at night, and this kind of aids in decreasing the pain overall. And that's it. So here at Hingham Physical Therapy, what's kind of nice is we see a wide spectrum through the lifespan. We see everybody from pediatrics to elderly, handling post-surgical, acute injuries, sports-related, balance, and even some just muscle weakness overall. So it's kind of nice that daily we see such a wide variety in patients.